Hello and welcome. Today I will provide you with information about the wonderful benefits that skin to skin care can provide to the full-term newborn. Let's begin. By now you may be wondering, what is skin to skin care? This is a technique that originated in South America. Initially, skin to skin care, also referred to as kangaroo care, was started to help keep premature infants warm after birth. This method was implemented due to the lack of proper equipment needed to stabilize the preterm infant. The process of skin-to-skin care can best be described as the act of placing the naked infant directly against the parent's chest for an unspecific duration of time. The non-conventional, easy, and cost-efficient aspect of this measure make this a fairly simple method to implement after the birthing process. Kangaroo care is highly implemented in most neonatal intensive care units due to the benefits that it can offer. The full-term newborn, however, is not usually considered for this method following delivery. Optimally, this contact should be introduced immediately following birth. We will discuss this aspect later on within the PowerPoint. Let's discuss the reasons why kangaroo care should be used in the hospital setting on a routine basis. There are multiple benefits that cannot be overlooked. Not only does this technique promote bonding, but it also serves as a source of warmth and an adjustment phase for life outside of the womb for the newborn. Kangaroo care has been found to help stabilize the newborn's heart rate, oxygenation status, respiratory rate, and temperature. Bergman and Bergman found that the baby is biologically expecting to hear the mother's familiar voice and heartbeat, the mother's smell, the taste of breast milk, and warmth from her body after arrival into the world. Although the mother is primarily referred to in this process, the father can interact with their newborn in this way as well. As professionals, it is our responsibility to provide support and the best evidence-based practices to our patients. Parents, especially new, may be hesitant to use kangaroo care with their newborn. The nurse prior to delivery should discuss this procedure in detail. Methods of teaching that could be used include demonstration, reenactment, or the viewing of a video. Educating the parent of the potential benefits is an important step. Along with education and demonstration, the nurse should also evaluate the parent throughout the process. Positive reinforcement may be needed for parents who are uneasy with this process. As stated before, the naked newborn is placed directly onto the bare chest of the parent. A hat or blanket may be used if needed. In the world today, kangaroo care is not formally introduced after birth within the hospital setting on a routine basis for the full-term newborn. Due to this very fact, the initial contact that the newborn desires is disregarded. Crenshaw found that the routine separation of healthy mothers and babies can be harmful and negatively impact short and long-term outcomes as well as breastfeeding success. Current conventional methods that may take place include obtaining vital sign parameters, administration of routine newborn medications such as erythromycin or the hepatitis B vaccination, obtaining the weight, and the baby's first bath. Although routine care normally takes place, such procedures are not proven to be the best evidence-based route for the newborn. To address the problem previously discussed, I have formulated a PICO question. The PICO question is, in the newborn, how does initiation of skin-to-skin care immediately following birth, compared to conventional care, affect thermoregulation and physiological parameters? Research performed on this problem will help unearth latest studies and obtain positive results. The purpose of formulating a PICO is to present a detailed problem and provide the best evidence-based solution for our patients. Through this process, healthcare professionals can offer this care within their practice. Research studies often use theories or models as the foundation by which they format their research. Skin-to-skin care directly involves the nursing staff. The nurse is primarily responsible for both the parent and newborn pre and post the laboring process. Virginia Henderson developed the nursing need theory with the intention to increase the patient's independence. In this case, it would be the mother. The purpose of this theory was to help increase the independence during the hospital stay and also after discharge. Three main expectations were stated by Henderson. Number one, Henderson expected the nurse to help provide care for the patient until they could do so independently. Number two, care was to be rendered continuously for the patient. And finally, number three, the nurse should be educated in both arts and science. The purpose of this theory is to help assist the patient until they are able to perform 14 specific basic need components. These components address the physiological, psychological, spiritual, moral, and sociological aspects of the individual. A few of the basic human needs developed by Henderson were the ability to communicate with others, maintaining body temperature within a normal range, obtaining proper sleep, and discovery that leads to normal human development. Due to the fact that skin-to-skin care will be initiated and evaluated by the nurse, this model complements the concept well. As stated previously, the research process may be structured around a specific model. The Iowa model of evidence-based practice to promote quality of care would be a great candidate to implement findings pertaining to skin-to-skin care research. There are multiple phases that take place within this model. First, the change, in this case skin-to-skin care, must be identified as being needed. You could ask questions like, is the best evidence-based practice currently being implemented? Will this change help benefit my patient? After concluding that there is a need for change, a research team will be formed. This group has the task of researching the topic and finding evidence to either support or disapprove the proposal. The next step is the formation of a pilot study. This phase will allow the facility to personally validate the benefits of the change and also identify any potential risk or disadvantages that may occur. The next phase is to implement it within the practice. Once implemented, the process is not complete. The change implemented per the Iowa model should continue to be evaluated for its success. This will help ensure that it is effective and enhancing the care provided to the patient population. Research on skin-to-skin care in the full-term newborn, although limited, was found. All articles in the literature review performed comparison studies between skin-to-skin care and some form of conventional care method. All studies addressed thermoregulation, while others also included physiological and neurobehavioral responses. Article A was a quasi-experimental design. The physiological and behavioral state of the newborn were the variables compared. Article B was a randomized clinical trial. Article C studied thermoregulation after a cesarean section. This particular article is unique due to the fact that it observes the newborn following a cesarean delivery. The study did not find a difference in the stabilization of the newborn's temperature compared to those who obtained standard care. However, there also was not a decrease in temperature noted either. Article D is a quasi-experimental study that focused on the temperature, respiratory rate, heart rate, and oxygenation status of the newborn. Article E conducted a qualitative study that was guided by a behavioral framework. Lastly, Article F involved a randomized control study conducted in Ghana. Although the temperature of the newborn between the control and study group did not show a significant difference, skin-to-skin care did serve as an adequate means to stabilize the newborn temperature. Overall, the articles reviewed expressed the beneficial factors that kangaroo care offers. There was not a risk of hypothermia or unstable vital sign parameters when monitoring the infants during the kangaroo process. When performing research, you must keep the rights of the participants in mind. Everyone is entitled to basic human rights, and they should never be violated. Prior to your study, you should ask questions such as, are the participants aware of the concept? Are they able to fully comprehend what the research entails? Is the population biased? Are the individuals involved a proper representation of the community? If you can answer no to any of the following questions, the research is likely to spark controversy. Keeping the rights of others in mind is pertinent if the research is to be taken seriously. The need for research is of high demand. In order to provide the best possible care, healthcare professionals must actively seek opportunities to perform quality studies. Research cannot take place without funding. Skin-to-skin care is not highly researched, therefore the beneficial aspect of it is not fully understood. The National Institute of Child Health and Human Development is a program that is dedicated to the enhancement of life from preconception and beyond. They also hope to help the newborn reach their full potential while ensuring health, independence, and well-being. This foundation, which was started in 1962 by Congress and personally requested by the President, would be a highly potential source of funding due to their mission to better life. Let's review. Skin-to-skin care provides benefits to not only the parent, but also the newborn. The heart rate, respiratory rate, and temperature are evidence to stabilize better during the use of skin-to-skin care versus routine newborn care. Current routine care is not fully supported by evidence-based research and should be reevaluated for its efficacy. With the physical, emotional, and psychosocial aspect in mind, skin-to-skin care should be offered as a part of routine care immediately following birth for the full-term newborn. Although there are studies that demonstrate the effectiveness of skin-to-skin care, more research is needed in order to further support the cause and bring awareness to this rewarding technique. For further information, please review references listed. Thank you for your time. I hope that you have enjoyed this presentation about skin to skin care and the benefits that it can offer to all newborns.